Good afternoon, everybody. We're delighted to have you all in attendance today for Depaul's annual report launch. In light of current circumstances, we're delivering our annual report for 2019 in a completely new way, and we're really happy that you could all join us. I have David Carroll with me today, the CEO of Depaul, and you'll notice throughout this that in the studio we are maintaining social distancing. We won't be wearing masks for obvious reasons. My name's Dermot Murphy. I'm the Director of Services and Development for Depaul, and I'll be your host for today's event. David Carroll, the CEO of Depaul, will be joining us in the studio throughout the event. And we'll also have some very special guests who will be linking in remotely to add their knowledge and experience on some topics we will cover. Our speakers today include Roseanne Hegarty. Roseanne, you're very welcome today. And Roseanne is the President and Chief Executive Officer of Community Solutions, which assists communities throughout the US and internationally in solving the complex housing problems facing their most vulnerable residents. Dr. Cliona Nikielik, pioneering consultant in general medicine and infectious disease in St. James's Hospital in Dublin, and a member of the world's first consultant-led inclusion health team, working with those experiencing homelessness. And Mick Finnegan, a person with lived experience, a mental health campaigner, and a public health speaker. Throughout the event, we'll touch on 3 separate themes from our annual report. These include laying foundations, stepping up, and building permanent solutions. At each theme, we'll be joined by one of our guest speakers who will offer an insight into that theme. We'll also be formally launching our Depaul Housing Association, which was established towards the end of 2019, and we're happy to say is fully operational now. But first, we're joined by the chairperson of Depaul, John Murphy, who will do an opening message. John, over to you.
Chairperson for Depaul, and thank you for joining us today for the launch of Depaul's 2019 annual report. During this difficult time that we now find ourselves in, it's important just to reflect on past achievements and accomplishments. So today's event is all about doing just that, to look back at Depaul's achievements in 2019 and to take stock. Keeping in line with the theme of this year's report, we can see that Depaul has come a very long way since its inception in Ireland in 2002. 2019 has seen the organisation take vital strategic steps, many of which will be of huge benefit to the people we aim to protect the most, those people experiencing the uncertainty of homelessness. Since the very beginning, Depaul has been a provider of specialist care. The low threshold model, which is commonplace across many services today, but was non-existent, certainly in Ireland, when Depaul began many years ago. In many ways, Depaul has been a pioneer in this regard, realising services which many would have dismissed as not workable or achievable. However, undeterred, Depaul carried this approach with it, and last year we helped 4,806 men, women and children. As the years progressed, the problem of homelessness, both in the Republic of Ireland and Northern Ireland, has grown very significantly. Depaul has had to step up and meet this need, particularly in Dublin, where street homelessness had become a huge problem. Depaul reacted and at one point was providing over 200 one-night-only emergency beds to meet this need. However, we have always believed that there is a better model of care than just one-night-only accommodation. Working with our partners, we have been able to reduce the number of emergency beds we provide dramatically in 2019. In its place, we now provide a more concerted model of care where people are guaranteed 6-month placements and 24-hour access to their bed. Most importantly, they are provided with a key worker who works with them to build their way back out of homelessness. We've ensured there is somebody there when they need it most. As Depaul grew, it was important to ensure our work and our values remained relevant into the future. In 2019, we made that possible by setting up Depaul Housing Association, This is a vital step to help future-proof Depaul as an organisation, and also to realise our mission of ending homelessness and helping to change lives. What this allows Depaul to do is to offer permanent solutions to homelessness, taking the organisation from service provider to housing provider. So we've already had initial success, with 4 Depaul service users being provided with a permanent home thanks to Depaul Housing. Our aim is to provide a steady stream of housing units to those who need them most. With Depaul Housing, we are building permanent solutions to homelessness. So thank you for joining us today. On behalf of the Board of Trustees, I'd like to thank all of the staff and volunteers at Depaul, but most importantly, all of the service users who continue to inspire our work. Thank you.
Thanks for that, John. Now we're going to show a short video which gives an overview of Depaul and its work throughout 2019.
Hello, I'm David Carroll, Chief Executive of Depaul. Depaul is a cross-border charity that has been working to support people who are homeless or at risk of homelessness since 2002. Our work centres around our values and our belief of the potential of people to progress to more positive futures. Throughout 2019, we continued to protect the most vulnerable. As the number of those experiencing homelessness continued to grow, Depaul provided shelter, support, care and health interventions and so much more to over 4,000 men, women and children. We provided vital support by meeting people and families where they are at, both in our services and in communities all across the Republic of Ireland and Northern Ireland. Our Housing First service in Belfast and Derry continued to provide move-on accommodation for people experiencing addiction, allowing them to manage their needs while at the same time living independently. In the Republic of Ireland, our new Cusan Nua or New Pat service worked across 7 counties and helped over 300 people exit direct provision. It enabled those with the legal right to remain in Ireland the chance to become part of our community across the country. Across all of our services, our staff continued to provide vital health interventions. On 63 occasions, our dedicated staff spotted the fatal signs of overdose and intervened to save lives. They also provided vital support to those struggling with severe mental health issues. By the end of 2019, our housing association, Depaul Housing, was fully operational. This long-term project has been an aim of ours for a number of years, and we believe into the future Depaul Housing will allow us to build permanent solutions and end homelessness for those most marginalised in our society. 2019 was a challenging year, but through the help of so many people, we remain committed to supporting people who need us most in society. Depaul will continue to adapt as needed to ensure everyone has a place that they can call home. Thank you.
So wow, looking at that video, there were some incredible statistics in terms of the numbers that Depaul have helped throughout 2019. So David, first thing I'd like to ask you is, what were the real success stories during 2019?
Well, Dermot, I'm delighted to be actually here today to launch our annual report, and very much the report is in a way a bit of a reflection for ourselves as an organisation of where we're at in 2019 and going into 2020 with the COVID challenges. You know, we're looking at, I suppose, how we laid our foundations as an organisation, how we've stepped up to the mark around providing innovative solutions, and now looking at the future around building permanent solutions for people as well. And looking at the annual report, I suppose it always comes back to the people that we work with. I think they're the real successes. Bobby, who's featured in the annual report, very much talks about his distraught and how his life had been destroyed, and he ended up in homelessness, and in Stella Maris, and the ambition that he and others had for himself in order to be able to move on to another part of his life through Housing First. And I think Aileen, who was our volunteer, she's featured as well. 9 years in front of the reception and back lane, offering a welcoming and smiling voice that absolutely encapsulates the values of Depaul. If we look at, I think, a key piece for 2019, it was working with DRHE and Eileen Gleeson and her team to transform 3 of our services into 24-hour services. I remember being there on the morning in Brew, Imeshire, which was an emergency accommodation for 101 people in Thomas Street, and remember being there on that last morning, seeing people leaving with their knapsack sacks and thinking, do you know what, tonight people are going to be in 24-hour beds. So I think that fundamental kind of switch to those emergency services that were really needed at that particular time to deal with the crisis, to move to that perspective, has been significant. I think the other piece, going back to service users and people with lived experience, has been the establishment of the health peer mentoring scheme. And Cleena, who's here today, has played a big part in the formulation of that. And that's a service that offers support to people in homelessness to access health-related services. And it's people with lived experience and who they themselves might be in homelessness. And it's a real signal for us in wanting to bring service users more into the centre of the work of Depaul.
Hey, that's great, David. Thanks for that. And the next thing I'd like to talk about is, in terms of the organisation's strategic aims, what did Depaul achieve during 2019 in your mind?
You know, I talked earlier on around laying the foundations. Depaul, I think, since it began nearly 18 years ago in Dublin, was the first to set the likes of Clancy Barracks, which worked with intravenous drug use in young people. It set up Stella Maris in Northern Ireland. It set up Ainger Street, and then Orchid House, which was an alcohol managed or wet hostel in Dublin. And we've been known for a reputation around taking chances, working with people who are at the greatest risk. And I think going forward and in looking at our direction, I think there's other parts of our work that have been really successful this year, that we've taken that innovative approach. Our scheme and project, Cusan Nua, or New Path, which is funded by the Department of Justice, supports people coming out of direct provision who have the right to remain in Ireland to be able to establish roots in Irish life and Irish community. And we assisted over 250 people, and that's continued into 2020 as well, where even during COVID we've established over 350 tenancies for individuals as well. So it's been a huge success for us.
And then, you know, when we think about Northern Ireland, You know, you're talking about establishing new ways of working. We have Housing First and Stella. Tell us a little bit about Northern Ireland.
Well, Housing First has been, again, I think, a major achievement. We're going from strength to strength. 2018 would have seen us launch our Fidelity Report, which kind of validated the service to be one of the adhering to the international standards for Housing First. And I think 2019 saw us take an additional step in trying to advocate with government and advocate with government departments to make Housing First a regional imperative. It's in the NIHE Housing Executive's homelessness strategy. Now's the time to take it to a different level.
Okay. And when we're thinking about Housing First and next steps with regards to what we've tried to deliver through 2019, where would you see that going?
I think today, with the launch of Depaul Housing, it's a real signal for us on our complete commitment
Absolutely.
to long-term housing solutions. You know, we've traditionally, as I said at the very start, had been working and have worked from a reputation of low threshold working, sometimes at a subsistence level. We've progressed. We have laid those foundations of skills, knowledge for that particular group of people who are most marginalised of the most complex issues. It's now time to take and lay those foundations and translate that into community housing and housing provision.
Yeah, and I think very much what you're talking about there when you've talked about Stella and Sundial and Back Lane and moving into those community-based approaches, it's that housing-led, longer-term accommodation we're looking to deliver on, isn't it?
Depaul has housing-led, housing first approaches at the forefront of its approach there. You know, I think what we want to do is to make sure that our learning and our knowledge in working with people with levels of complexity is translated into the community. Okay,
thanks for that, David. Reflecting on 2019 and in the context of 2020 and the backdrop of COVID, what do you consider the key objectives for Depaul in supporting the most marginalised going forward?
Well, look, what a year it's been kind of so far, and obviously there's an immediacy in where we face ourselves and where Depaul faces at the moment. That immediacy is making sure that we do, on both sides of the border, work with homeless people to make sure that they're fully protected during this this period until we can get a handle on the future of COVID and the infection. That immediacy issue will be translated into us delivering services on both sides of the border, new services as well, in order to be able to provide in-reach nursing and dual diagnosis services into the likes of the cocooning and shielding units. So that's a particular kind of focus for ourselves. I think the continued approach around taking a twin-tracked approach to our work. And what I mean by that is that our work very much has to engage with people where they're at. The people who are rough sleeping, the people who have the most complex issues, the people who find themselves in homelessness due to major complexities in their lives. And that approach has to continue because it's what we are best at and what we've got our reputation on. The second track is now refining the approach into community-based services. We have a service in Dermot, Housing First, and a harm reduction service, which provides in-reach support to people in their own homes who have never been in homelessness before but have complex mental health and complex drug and alcohol problems. That's the type of service that we would want to see kind of rolled out, working in our communities, working with complexity and working from a prevention of homelessness perspective as well.
And I guess the importance of partnership then with the various health bodies in both jurisdictions comes to the fore.
It's critical. We wouldn't be able to do our work without the critical partnerships, Dublin Regional Homes Executive, the HSE, Department of Justice, in Northern Ireland, the Housing Executive, public health agency, as well as our voluntary partners.
Yeah.
And that's key as well.
Okay. And David, the last question I'd have here in this section is, what sort of society do we want to see in the next 10 years?
I mean, what a question. But we are at a pivotal point, I think, in terms of COVID. And I think the decisions that we make in the next year or two will have a real impact, I think, in what the long-term perspective will be around homelessness. And the reason I say that is that we've learned a lot of lessons from coming out of the last recession, where funding was cut from a HSE perspective. And the capital investment for the building programme was cut and stopped. And I think that the perspective on keeping our eye at the moment on not allowing COVID to provide an austerity perspective is hugely important in the impact that we will have in the next kind of 7 or 8 years.
Sure. And then, like, when you're thinking about how we go forward over the next 10 years, clearly housing supply and how we create those long-term solutions you've already talked about will be pivotal to that, right?
Yeah, part of that is maintaining our funding streams. You know, I've talked about the capital piece already.
Sure.
But part of this as well is community infrastructure. People will not, the people that we work with have complexities. Sometimes they have to leave their communities or because of those complexities. In order for us to be able to support people and put people to make a success in getting roots in their community will be that infrastructure, vocational, particularly health, other employment related pieces, life skills. We found that social isolation in housing first tenancies is a big issue. How people are supported to enter into communities, to be with their neighbours, to participate in community activities is all part of, I think, the direction that we need to go in making sure that people with the most complex issues can survive.
So that idea, the services are finding their place and finding their voice, if you will, giving them something to talk about.
Absolutely, finding their roots
Yeah.
in their community, and that's not just sitting in a tenancy on their own, festering away.
Okay. Within this year's annual report. And with that in mind, I'm delighted to welcome Dr. Cliona Nikierlik, who is joining us to discuss themes laying the foundations and the beginnings of specialist care. Cliona, you're very welcome.
Thanks a million, Dermot.
Great.
Nice to see you.
And to see you. Great to have you.
Hi, Cliona.
So, Cliona, first thing for you, for those that might not be aware of you and your work, could you give us an insight into the role that you play in medicine, and in particular in inclusion health, and what inclusion health means?
Sure. So I qualified in 2003, and I did my specialist training in general medicine and infectious diseases. And I worked a lot with people with HIV in Dublin. So HIV is a real success story. You know, the tablets work amazingly well. And once people take their tablets, they can expect to have a normal life expectancy, don't need to use condoms, can have babies, all kinds of fun things. But we would have had a small number of patients that I looked after, a small proportion of patients who were from our local area, background of injecting drug use. And, you know, we thought our clinic was super friendly and, you know, all the medication is free and it's all there. But these guys didn't come into clinic, didn't take their tablets, got very sick with AIDS, and a lot of them died by the end of my first year working in the clinic. And I was really struck by that, and struck by how, you know, that gap between when we think something's accessible for people or available for people, but it doesn't actually reach them. So that was how I got started, and I went down a rabbit hole that a lot of what I learned from Jess Sears and from you, Dermot and David, and friends in Depaul. And really what we do in inclusion health is it's about making the onus is on us as healthcare professionals to make sure that our services reach those who need them the most. And in order for that to happen, we need to do a number of different things. So we'd very much work on a low threshold ethos. You can drop into clinic. We try to make it really welcoming and friendly for people who tend to feel shamed or stigmatized when they come into healthcare. We've built up our specialist knowledge, both in terms of the diseases that we look after and the specialist knowledge that you need to look after people who are homeless and have had very difficult lives. And again, thanks to Depaul for teaching us lots of good ways to do that. And then we're very much integrated with our colleagues in the community in Depaul and in other sectors or other services, because the people that we work with really need that input from housing, from accommodation, from key working, from health. All of that really needs to be very well integrated in order to meet their needs. And it's the best job. I have a great job. So I work with a nurse called Anne-Marie Lawley, a social worker called Neva Rourke, and we have a matching team in the Mater led by Tara McGinty, who's the consultant there. Sarah Jane is the nurse, and Julie is the social worker. And we're hoping to spread it out nationally. So that's what we do.
Well, that's great, and I think your enthusiasm shines through on it. I'm going to ask David a question about this now. So, David, when we think about inclusion health, what role do you see Depaul currently playing in terms of inclusion health to homelessness?
I think Lena touched on a really important point there, and it's about access, and it's about access to services. One of our big successes, I think, as an organisation, is that we've created access. We've created access from a values base that accepts people where they're at. But I think that's translated, I think from looking at the history of our services, I think that we knew from the very beginning that health was core. You know, that in order to be able to support a person coming off the streets, or a person who had a 20 or 30 year entrenched alcohol difficulty and homelessness history, that there was a need for energy to be kind of put into that whole aspect of work. And I think that's how our approach has evolved, very much in partnership, but I think internally within our service provision, but also as well I think with the partnerships that we've developed externally. And if you look at ways in which we've tried to take a health inclusion perspective, some really great examples of work, you know, and maybe something that is not immediate at first glance, but we work with a lot of families. We have a number of family hostels in Northern Ireland, and we've got a childcare worker there who works with our families across 2 hostels and other community services as well. And that worker works on nutrition and positive health practices for families, but also for children as well.
Sure.
Supporting parents to support their children to have the best approach to their health and their diet. Look at our nursing services, you know, within our projects. Look at how we've rolled out naloxone, which in our annual report this year that we've, you know, unfortunately we've had to save 63 lives last year with the use of naloxone. So there's countless examples by which we have adopted the health inclusion approach, because we think that access piece is huge.
And we think about it, like I'm thinking about the stuff, for example, we done again with St James's Hospital and with Cliona around Tilda and premature aging.
Yeah, absolutely. And Cliona's here today and has been a huge support for us to, I think, to get the evidence base behind what we do. I think this is, you know, we look forward, Depaul really wants to strengthen its research base. And we did with Cliona, led by Cliona, a couple of years ago, a report on premature aging, which showed that people's age who had the experience of homelessness was probably 20 to 30 years more from a physical perspective than the general population. And then we posed the question, you know, why people pass away in homeless services. You know, people have difficult lives. Homelessness hastens the deterioration of health. It's imperative that we put the structures in place in order for people to be able to be supported.
And I think that's leads us on really nicely to our next question. Cliona, touching on the theme of specialist care and looking at the importance of low threshold services, what role has low threshold played in terms of caring for those experiencing homelessness and addiction? And particularly interested in how you see it from an inclusion health point of view, because I know you've already mentioned low threshold.
So, I mean, I think one of the many things that Depaul does really well is that low threshold approach, because it means that everybody, it's very needs based. So people who need your services can access them, and you really meet people where they are, and you don't set conditions upon their engagement or upon them, staying in your accommodation. You take them where they are and work with them then at their own pace and according to their own desires to move on from there. And I think that's a really, really important concept that healthcare generally doesn't include. So we tend to be very black and white. That's how we're trained. We tend to think, we tell somebody to stop smoking, they should stop smoking. And we don't really question what that means in terms of who we're denying care to. And usually it ends up that you're denying healthcare to people who need it the most. So that low threshold approach is really important. And it's really important to have it, that you have a low threshold setting in which you can meet quite high healthcare needs or complex, multimorbidity needs. And Sundial, which is just across the road there, is a really good example of a setting in which the residents have very, very high healthcare needs, very high levels of chronic multimorbidity, mobility impairments, cognitive impairments, but all of those needs are met in a low threshold environment. And I think that's pretty unique and really extremely valuable, both for the individuals and for society and systems.
Yeah, and I think part of that, Cliona, is as well ensuring that you have those key partnerships, isn't it? Like, we obviously, within those services, provide low threshold residential accommodation, but on the other side in St James's Hospital, there's a low threshold medical intervention happening.
And it works really well when everybody, I think, shares that ethos and is aware of what truly doing low threshold, person-centered, integrated work means. Then it's actually very easy to do the work, because you need one single tool, which is this, and a list of phone numbers, and you can provide really good care that's very satisfying. And I think, from the hospital's point of view, we really appreciate the work that Sundial does, because these are people who otherwise, would be left on hospital inpatient wards waiting for nursing homes in a way that really denies their independence and their personhood. So yeah, it works well on all sides.
That's great. Cliona, thanks so much for that. David, I want to just come back to you and just sticking on the idea of low threshold services. What role has Depaul played in delivering this type of approach?
Dermot, I suppose the definition around low threshold for us is probably working with people where they're at and trying to engage with people no matter what their own personal kind of situation or history is, and providing services. I think that work, and I think there's a greater kind of emphasis for us on what works. Cliona spoke about Sundial House there, but also we have Stella Maris in Belfast, and we've also got Orchid House as well. They all work from an alcohol managed perspective, and our approach is not just values based. It has a method behind it. It has an approach behind it. We have a whole set of alcohol management protocols. We want, and we work really hard in training our staff in the methods to be used in order to work with people effectively. I mentioned already that I think research and evaluation and monitoring of what works is becoming even more important for us, not only from us being true to ourselves, but also being true to the public purse. We need to be able to justify the financial investment that's been given to us both by the public, but also by statutory services, that what we're doing has an improvement for the individuals. It's about health improvement. It's about social needs improvement. It's around life skills improvement. But ultimately, it's about ending homelessness and getting and working with people to get into their own homes. And
you were talking about there previously that twin tracked approach. How important is that for low threshold services?
There's still a need, unfortunately, for crisis intervention. We would like to see a stage by which the use of hostel accommodation is minimised. That still still exists. We're working and we're advocating with government, and particularly around housing supply, that we can move away at some stage from the amount of temporary accommodation, but that temporary accommodation has had to be put in place. We want to reach a juncture by which there's a turnaround on that. And I know people are working really very, very hard across all of our statutory partners to get to that place. But whilst there's a need, Depaul are going to be there at that interface. But also as well, I think the bringing of our skills, our foundations, and our approach and knowledge into the community and into housing is that second track.
Okay, and thanks for that, David. Cliona, finally, I just want to come back to you and talk about, in light of the current COVID crisis, can you explain how your work has been impacted by COVID?
So, in a lot of ways, I think because of the integrated network that we had set up over the years, we were in a better place than lots of other parts of society when it came to the COVID crisis. So there was a really amazing unified response across the sector to cocoon and decongregate settings and to provide addiction support and psychosocial support, and that worked really well. So it was really nice when one of my we had a homeless gentleman who tested positive for COVID, and I was able to reassure everybody that this was probably the best best place for somebody to be COVID, that there was really good public health and interventions in there. And I think, yeah, it has really stood to us, all the work that we had put in over the years, as well at looking at, creative ways of getting people the healthcare that they need so that they don't need to come into A&E and sit on a ward for 5 days to see a specialist, but that specialist can phone the nurse in, back lane, or can all of those innovations have really hopefully come into their own. And I'm hoping that this is a good opportunity for the health service to look at how it provides services and maybe speed up some of those changes that we've been wanting to see. I think it was also really helpful when we had patients with COVID who had, addiction or had been homeless, who we needed to keep in isolation in the hospital. It was great to have had the kind of training in low threshold inclusion health that I've got through my association with Depaul and other people, in that, patients that would have been seen as being very problematic to keep in isolation, we actually knew, how to handle them, how to smooth their journey, and that's worked well as well.
And it's really great to hear all of that's happened. Dave, I'm just going to come to you for the last part and just ask you, what role do you think Depaul have played during the COVID crisis in protecting the most vulnerable?
Dermot, it's been an incredible 7 months. I think we all sat back, the whole country, and north and south, of what was ahead of us at the middle of March, and almost immediately we stepped into action and responded. We started working with the HSE immediately on the provision of additional bed spaces that were focused on providing shielding and cocooning opportunities, particularly for people who were in temporary accommodation and rough sleeping, who had those underlying health issues. And if you look at the success of that has definitely saved lives, and thankfully we've minimised the amount of people who have been severely impacted by COVID or even passed away due to those interventions that have been put into place. I think the other piece for me, and I think Cliona really names it well, the cooperation that existed between existing relationships and in some places new relationships. The voluntary sector has never worked as effectively as it has. The HSE and DRHE, both in the identification of cocooning units, but also as well the medical and nursing services that have been supported, and the funding that's come our way in order to provide these services have been second to none. I want to mention there in particular the work that we've had to do in existing services as well. From an accommodation point of view, we've had to change our practices. We've closed a number of beds due to having to adhere to social distancing principles, rightly so. We've converted some of our community services to doorstep interventions or technological telephone and IT solutions. Our day centre in Derry transformed its drop-in service to an outreach service both to the streets but also as a support services, delivering 1,200 meals over a 3-month period. Housing First set up a protocol and approach in order to be able to support making sure that there was medication drops that there was access to detoxification. It's been a remarkable effort, and I think the thing now is how do we keep this going?
Yeah, and I think one of the things I think that worked really well for Depaul during that time would be the work with both jurisdictional governments, so in NI and in ROI. Do you want to talk a little bit about that?
Yeah, an interdepartmental group was set up in Northern Ireland that I think we played a really good part in partnership with our voluntary sector partners. We also advocated really, really strongly both to the NIHE and government for the establishment of a homeless sector coordinator. That was the bridge between the voluntary sector and services and the statutory services. That was hugely important. Government in the Republic have really responded in terms of that we are part of a task force that has been set up by the new government on homelessness. And I think we really have our eye now on what happens next and what happens this winter.
I think that's a really good point to go on to there before we wrap up this section, which is just COVID into the future and sustaining everybody. What do you think we're facing into there?
Well, look, there's an immediacy around what happens in the winter, and we're really optimistic. Obviously, there's the budgetary issue in terms of how the 600 million of the winter contingency is going to be utilised, and we really feel, from a cost effectiveness point of view, but also from a saving lives point of view, that part of that money needs to come to homelessness services and services like that Cleaner runs, around from a health inclusion point of view. They need to be enhanced and bolstered. Mental health services need to be bolstered as well, and we're optimistic again that will occur in our discussions. But there's a longer term issue of what happens to individuals who are in cocooning and shielding units,
Sure.
And where do they end up from a long term perspective.
Okay, and thank you so much for that, David. So that concludes the theme of laying foundations, the beginning of specialist care. I'd like to thank Lena for joining us and giving everybody a real insight into the importance of specialist care and the vital work that both Lena and her team at St James's do in terms of furthering healthcare for those experiencing homelessness. So, moving on to our next theme of stepping up. I'm delighted to welcome Mick Finnegan. Mick, you're very welcome today, and thanks for joining us and taking the time with us today.
Thank you. Thanks for having me.
No problem. Mick, look, I'm just going to start straight off. If you could, for those that might know you and don't know much about you, maybe you could tell us a little bit about you, your background, and where you're currently at in life.
Yeah, so I'm from the inner city originally, but I spent quite a long time as a rough sleeper in Dublin, accessing several services from the Black Lanes, the old Santa Maria, Cedar House, York House, the day centres in Merchants Quay and Focus Ireland, the extension service. I experienced homelessness for quite a number of years, from my teens right up until my early 20s. And now I'm currently working as a national advisor with the Royal College of Psychiatrists in London with their mental health safety improvement programme. And I'm a student at Trinity College Dublin studying philosophy.
Wow, Mick, you've such a great CV there. Maybe could you tell us a little bit about the stuff you're doing on mental health? Because that sounds really, really interesting.
Yeah, so I initially kind of got into kind of working in the kind of the social care stuff through a guy that helped me get off the streets, Howard Russell. And that kind of gave me kind of it was mainly the catalyst to kind of help and support people. And then I saw a role that with the Royal College of Psychiatrists, they were looking for national advisors, experts by lived experience, to kind of help improve services that are being provided. And initially I was kind of apprehensive because I thought it might be slightly tokenistic in its approach, but you're sitting around a table with psychiatrists and medical professionals and public health experts, and they listen to what you have to say because you've been there. You've accessed those services, and then they take everything on board, and then they implement that through a quality improvement program, which has been it's been running across the UK for the last number of years now, mainly in England.
That's amazing. Mick, thanks so much. I'm just going to move over to David. So David, just coming to you, and I think it's a really good point to come over to you on. One of Depaul's main values is celebrating the potential of people. How important is this concept when supporting people with complex needs?
Well, I think, listening to Mick, I mean, there's no better example of somebody who has taken control of their lives. You know, Mick has described himself, you know, and what he's experienced himself with becoming homeless, but also as well has actually tapped into his own potential and really translated that into becoming a kind of a key advisor in the development of services kind of going forward. And so thanks, Mick, and you know, best of luck with your next steps in all of that. And from our perspective, I suppose it is thinking in terms of where we take our approach with service users going forward. You know, we have a number of programs, as I said, the health peer mentoring program, our befriending program as well. What we'd want to try to do is to take a greater focus around vocational and employment development, take our particular progression as an organisation a further step in order to be able to support people to access employment and vocational development. I think that's something that we can definitely do better. I think there's obviously pieces around, you know, we are encountering new challenges as a society, and we need to listen to different voices. The Black Lives Matter approach and this year has been fundamental in a change of perspective for ourselves in Irish society and in the north as well. I think it's a huge influence for us in terms of how we work across the country on with diversity and difference, and that's hugely important for us. We've established a new service, Cusan Nua, that goes into direct provision. The future direct provision will be key in the next couple of months, and the voices around that are going to be important.
So when you're talking about service user and finding the service user's voice, I think a really interesting one is that conversation we were having about William. I think it'd be really good if the audience heard that. I think it's a great story.
I was fortunate enough to share a platform with one of our service users a couple of months ago. There was a webinar that was being organised by the Centre of Homeless Impact in the UK, and William, who is one of our Housing First service users, took part as well. Carol Lee Quilleen, the Minister for Department for Communities, was present as well, or did a recording. And at the end, William was asked, you know, what can Depaul learn from you? And he was stumped a little, like, you know, but I think my retort was, look, William, we've so much to learn from your experience and how you've made a success of this tenancy. And William showed us around his flat, gave us a virtual tour, and I think it is incredible. I think, like with Mick here, I think always the service user voice always is the one that's most authentic, and I think without, and that word tokenistic, Mick, without being tokenistic, I think we have to genuinely put people with lived experience more to the centre, the centre of our service.
Mick, I just want to come back to you. You've spoken previously about people that have supported you in services, and you've mentioned them already today, such as Howard Russell and his importance in your life at a time of difficulty. Could you explain to others how they've helped you and how important it was to have someone like Howard in your life at a difficult time?
Absolutely. Like, Howard was literally, like, he was kind of like, if you worked in homeless services 25 years ago in Dublin, you knew him because he was the centre manager of Cedar House. And, you know, I was too young to access services. You know, I was under 18. I was kind of floating around. I was sleeping rough, going to various day centres and stuff like that. And Howard went out of his way to befriend me and to kind of support me during a very difficult and challenging kind of time in my life. And he gave me a hope, you know what I mean? He gave me a hope that, you know, this will not always be like this. While this is a difficult time in your life, it's not always going to be like this. And I think that hope then kind of gives you a purpose, and then that purpose then builds resilience. And for me, you know, working with Howard, and even still to this day, we're still, you know, he's no longer my project worker, support worker. He's more of a kind of a mentor slash friend, best friend actually, because we talk pretty much most days about how I'm getting on and stuff like that. And I think it's very important to kind of really focus on the relationships that people have with the people that we support. I was chatting to my my auntie the other day, Ashley O'Shea, and she works in Sundial House, and she, puts the relationships that she has with the clients that she works with to the center of everything she does. She's so passionate about helping people that experience homelessness and that loneliness, that even just from chatting to her, that inspires me. Do you know what I mean? And I think it's really important that we don't, as service providers, lose that kind of spark, because I think compassion fatigue can often lead you be more damaging, because then you don't have that kind of empathy as much as you used to. But I'm very, very lucky that Howard never gave up on me, because a lot of people did. Because I'm not going to lie, I was a pain. I didn't engage with services. I didn't, I used to tell the CWO to go and take a run, skip and a jump. I wouldn't, when I was up in James's, the homeless persons unit on James's Street, I don't think it's there anymore. But you'd be queuing up and you'd be just arguing with the security guy in the door because you were bored. You know what I mean? And I think it's really important to kind of, while it's great to support and to really kind of direct people in the life that they live, I think, providing meaningful activities as well is, key to kind of really making that difference.
So those relationships and those activities are exceptionally important, Mick. Thanks for that. I think that's a really interesting insight. Look, I just want to move back to yourself, David, and I'm just thinking that one of Depaul's aims in 2019, when we done the annual report, was to move away from one night onlys, and we've achieved that. So I think that was a really good thing. I guess the question I have now is, what do you see as the future of service delivery to ensure more positive outcomes?
Yeah. Well, Dermot, I think, we're about to go into a new strategic plan next year ourselves. And I think one of the fundamental questions that we're asking ourselves is, what works? I think going back to the issue of the investment in our services from the public and the public purse, ultimately we want to be able to structure our services that has the ultimate goal of not only the quality of life improvement and health improvement, but ending homelessness, and to be able to establish long-term housing solutions, I think is probably at the core of where we go next. I think it's an important point to kind of say that when we started, the numbers of people that we were working with, and we've always focused on those people who have the greatest need, and I see Depaul still having a huge national and cross-border and Northern Irish perspective to be able to bring, I think, the quality of services and the nature of services to the forefront. We want to develop our evidence base. We want to use an advocacy role, not in a confrontative way, but to bring the evidence base to funders and to government of, if you invest in this sort of way at critical junctures and critical times, it will have a great impact, and we absolutely want to put our focus on that. I think the other piece for me is around, we've always in Depaul been able to anticipate the needs that are around us. Tusnua, our service for women coming out of prison, is a fantastic example of that. Where we've been pottering away, with the probation service in order to provide an alternative to prison for women, and worked with women to put them back on track, both from a recidivism point of view, but also again from a tenancy point of view, where people have fulfilled their potential and rebuilt their lives and turned away from criminal background and engagement with the justice system. We see that work continuing from a Depaul point of view, able to engage at the cutting edge of of the issues that face Irish society.
Yeah, and I guess there's two things that come to mind when I'm thinking of this, David, as well. I'm thinking of that idea of how important will the community-related services be to us, and how important is that focus on singles for Depaul?
We've been one of the strongest voices, I think, in the last number of years around advocating for single homeless people. I think the transformation with DRHE of our services shows that. But there's now an additional step. There's probably around 3,500 single homeless people within the homeless population. They do constitute probably the biggest group within the housing list. There now is a need to take a step back and look at how we plan for this group from a housing supply perspective. It's not enough to just focus on the housing assistance payment or the private rented sector to provide the solution. I think with government's apparent commitment to an improvement in social housing, what part and what demographics do we need to take into consideration when we're planning social housing programs that takes into account single people and single people with complex needs?
So very much using that partnership again to look at how we address the singles' needs.
Partnership, but also I think, Dermot, we need to look at, is legislation required? What sort of regulation is now required in order to be able to work with our housing providers in order to be able to plan this in a better way.
Thanks for that, David. Now, Mick, you get the last question for this section, and hopefully it's not too difficult. I'm wondering, where do you see yourself in the next few years?
Who knows? I hope that I finish and graduate from Trinity College. That would be my main priority at the moment. But ultimately, that's just to kind of reinforce my knowledge, skills, and practice moving forward into a long career in health and social care, where I can hopefully dictate and shape policy that ultimately makes a real lasting difference to the lives of people in this country.
Wow, and I think that's really good to hear. I was worried that you're going to say you wanted my job, Mick, but it sounds like you're going for something bigger. Thank God. I think you have so much to offer around that, and I think you're very much an advocate for the service users' voice being found. Is there anything you'd like to say on ensuring the service users' voice is heard before we wrap this section up?
I think it's putting the service user to the centre of the services that you provide. Having someone that is a service user on your board or in your senior leadership team that can ultimately you can learn from them so that when you're developing or creating new services, that then you can actually say that this service has been co-produced, because at the end of the day, real co-production makes real results, gets real results.
That's amazing, Mick, and I think you're right. I think co-production is where it's at, and I think that's a really good place to conclude this theme of stepping up. I'd like to thank Mick for his valuable insights and for sharing his story with us. It was a real pleasure to have you join us. On behalf of Depaul, I'd like to say thank you so much, Mick.
Thank you, and I would like to say thanks very much for the support and services that you provided me when I was a rough sleeper all those years ago. It means a lot. Thank you so much.
No problem, Mick. Okay, and now we're moving on to the launch of Depaul Housing. We're going to show you a short video with some words from the chair of Depaul Housing, Eamon Conlon, and our housing development manager, Alan Dodsley.
Hi everyone, I'm Eamon Conlon and I chair Depaul Housing Association. I'm really excited to have this opportunity to formally launch Depaul's newly established Housing Association. Actually, Depaul Housing has been on the cards for a good many years, and in many ways was viewed as a vital next step in Depaul's evolution, a vital part of Depaul's mission to end homelessness and change lives. A lot of hard work and preparation have gone into getting to the point we're at now. The Housing Association was up and running at the end of last year, and carrying into this year, we've been able to secure long-term homes for people in Depaul services so they can move away from homelessness. In a sense, we're future-proofing Depaul's work, keeping Depaul's values present, relevant, and at the centre of our work. Given the numbers of individuals and families experiencing homelessness, we believe Depaul has a very big role to play in providing essential services, but also homes for people ready to move on from homelessness. I'm happy to say that so far we've secured 3 tenancies, with 4 people from Depaul Services moving into their new homes so far this year. And work has been continuing with steady progress. We hope to see more and more people moving away from homelessness in the near future. That's what Depaul Housing is for. Given the uncertain future we find ourselves in at this very moment, Depaul Housing's job is to provide certainty for people exiting homelessness. We are here to build permanent solutions and be part of ending homelessness. Thank you.
Hi, I'm Alan Dodsley, the Housing Development Manager for Depaul Housing, and my role is to develop permanent homes for people exiting homeless services. Depaul Housing is in its relative infancy. We only have 3 tenancies at the moment. I'm actually stood in the 4th property that we've purchased, which has been refurbished and will be ready for letting next week, but we've got another 20 odd going through the system. So by the end of 2020 we should be up to around 30 properties, 30 permanent homes for people formerly homeless. The most important part to me is giving somebody their permanent housing solution, giving somebody the front door keys to their new home. And the reactions I've got from the tenants we've housed today, to see somebody's face and how much it means to them to have their own home. You can deliver whatever support you want, you can deliver support services to people, but it's all predicated on having good quality, decent housing, and having that permanency, knowing it's your home, you're there for life. And that's the great thing about the job. We've been really fortunate so far in terms of the support we've got for the local authorities with whom we work. Fingal County Council and Dublin City Council in particular have been really supportive. In terms of the long-term future for Depaul Housing, ultimately ending homelessness is the aim. Providing sufficient accommodation that nobody should be homeless. Not just ourselves, other approved housing bodies as well, but we want to do our bit and deliver as many permanent homes as we can to as many people as we can and get them out that circle, that cycle of homelessness.
And now we're back in the studio again. I think that video was great for us all to see. David, I just want to ask you one question. How big of an achievement was it for Depaul to establish their own housing association? And what does it mean in terms of future service delivery?
Well, look, I mean, to be CEO, just after my first year anniversary, to be here,
congratulations,
and to be launching Depaul Housing is a huge honour. I think it's a real honour, but also I think progression, both for the organisation, but I think the wider sector as well, that we're now in housing. We have, as John Murphy had said earlier on, already 4 people within their own accommodation. And also as well, we hope to establish around 30 units before the end of the year. And we've got ambitious targets going forward. I think that the fact that, you know, you've heard from us right through all of this about our desire and our place in working with people with the greatest complexities, and for us to be able to bring that skill set into housing provision specifically, I think will benefit the homeless prevention agenda. You know, we will use our skills and our knowledge and our background and our innovative approach and our pioneering approach to absolutely make sure that tenancies work, and tenancies work for people that people have given up on. And we will not give up on them, and we'll work with our communities, and we'll work with our tenancies, and we'll work with our service users to absolutely make a success of Depaul Housing. I think the second part of this is that we have developed crucial partnerships with a number of approved housing bodies over the last number of years, because they're key partners for us. We see that continuing as part of Depaul Housing, that our skills and our knowledge can be shared with them, and vice versa, that they can share with us their approaches as well. I think we're part of also Depaul International, and there's an international campaign through the Vincentian family of a 13 homes campaign. And what we want to do is work with our Vincentian partners, both internationally and nationally as well, in order to be able to make sure that we can make Depaul Housing a success. And I hear a dog in the background who's absolutely supporting me in that as well.
Your first cheerleader with us today. I think just touching on the point you were talking there about some of the most marginalised and stuff like that, and what Depaul Housing can bring. What do you think is the role for Depaul Housing in dealing with what we've already talked about quite a bit today, which is singles, and singles in particular is an area that Depaul works very heavily in.
Our focus at the moment with the establishment of Depaul Housing is very much focusing on the provision of housing for single people, Dermot, and couples as well. I think couples, one of our first people to move into a Depaul housing tenancy was a couple. True. And a couple that have been through the mill and through the system. Yeah. And are making a huge success of their tenancy. So we want to focus on the people that we've traditionally had an impact with, and translate that to the community and to the establishment of tenancies.
Okay. And just the last piece I'd like to finish on in this section is you've talked there about sort of partnerships. You know, obviously you have your partnership with the local authority around funding the project, but also other AHBs. How important is that for our AHB getting up and running?
I think the partnership piece is huge, because I think, going back to the point, that we have a set of knowledge that can be of huge benefit to others and other housing providers as well. And what I would like to see is that Depaul Housing becomes integrated in wider social housing projects as we go forward, in order to be able to provide that integrated approach to social housing, affordable housing developments going forward, to take a very critical look not only at individual tenancies, but take a very critical look at how communities work, what components need to be in place in order to be able to support people who have had difficulties in sustaining their place in communities in the past. And I think that partnership piece around integrated community-related approaches is key.
Okay, thanks so much for that. And I think, David, that leads us nicely into the final part of the launch, where we'll touch on the theme of building permanent solutions. For this section, we're really thrilled to be joined by Roseanne Haggerty, all the way from New York. Roseanne is the President and Chief Executive Officer of Community Solutions, which assists communities throughout the US and internationally in solving the complex housing problems faced by their most vulnerable residents. She's also the founder of Common Ground Community, a pioneer in the design and development of supportive housing and research-based practices to end homelessness. You're very welcome, Roseanne, and thanks so much for joining us.
I'm so delighted to be with you, and my deepest congratulations on the launch of the annual report and the start of the housing initiative, which is absolutely thrilling, and I'm especially proud that it's part of the 13 Houses initiative. I've been part of the Board of Commissioners to that effort, and excited to know that Ireland is part of making that real for people who need housing. So I wanted to begin with appreciation for the team at Depaul, Ireland, and especially those that I met several years ago, and I had the opportunity to join many of you in Paris for the Vincentian Values course. And it certainly stuck with me that the founding question and the enduring question for Depaul is what must be done? And there's probably no better question for us to ponder when it comes to homelessness at a time when the world is struggling with a pandemic and the consequences of not investing in the health of our most vulnerable people. Here in the United States, it's dreadful to see how the rates of infection and death are really mirroring those who have not had access to health care or to safe housing, or to what we call the social determinants of health, the parts of our public health system and our way of thinking about each other that could have better protected those individuals, quite apart from our missing and chaotic national policy and leadership. But
Absolutely, Roseanne, absolutely. Roseanne, I think you're going to bring us through a 10-minute presentation on your work with community solutions. Is that correct?
that's right.
Yeah.
And can we jump in right now?
I
And
think we can. I'm getting the nod. So I think we'll hand over to you because I've seen your presentation. I think it's going to be really interesting for the audience.
Great. All right. And I hope I can see it so I know when, okay, there we go. And thank you to Jer behind the scenes who's going to be advancing the slides for me. Before the pandemic, we had realized in the course of our work over many years across the United States that homelessness was a different kind of problem than we perhaps thought it was. It wasn't simply a problem of individuals experiencing misfortune or of simply a lack of housing. We were seeing that even in communities that had adequate amounts of housing and were spending lots of money on an emergency response system, we saw that they were not making progress, that for all of the investment they were making, the dots weren't connecting. And so we moved in the last few years to understanding homelessness really quite deeply as a public health challenge, not just because those experiencing homelessness have, as we've been hearing in the presentations today, very poor health and poor access and experience typically of healthcare system without the intentional and caring efforts that we've heard about today. But in general, the complexity of people's lives who are struggling with so many challenges, including the absence of housing, we have found lends itself, solutions are found in the direction of a public health approach. And by that I mean collaboration, the use of evidence-based practices, and ultimately a focus on prevention. And that at the core of the work that I'm going to be describing, which has been quite breakthrough in the United States, is this notion that the what is to be done question with respect to homelessness forces us to look beyond running good programs to wondering how we have a population level solution, which means no one is homeless. What do we have to change in the way of policy? What do we have to invest in the way of effective practices? Who needs to communicate differently? And how do we think about this issue, not just program by program or organization by organization, but across a whole community? And in the United States, we define communities either by a city or a region. And those places, we work now with 81 cities or counties that really define their own geography. But in Ireland, you can imagine the translation to a town, a city, a county. But at the heart of what I want to describe to you is work that is about getting to zero homelessness, not simply running good programs. And let me say, I really hope that three things stick for you in my presentation, which is we now have proof that this is a solvable problem across whole populations. We need to understand it as a problem that requires both more housing or more affordable housing for those who are struggling, but that there also needs to be an accompanying operating system, which I'll describe, that makes sure people are getting what they need when they need it, and that no one's falling through the cracks, and that everyone's communicating about that outcome. And that lastly, now is the time to move on this issue, because literally the whole world is understanding that our health is connected to each other's health, and that we need to design public health systems, we need to design our communities, really starting from the most vulnerable, because if the most vulnerable in our communities are safe, that means we're all going to be safe. That's the measure. Can we make sure that the most vulnerable are getting what they need? Because if that's the case, the whole community can be at rest. So, Jer, if you could advance the slide, please. Our journey, and it's a way of understanding how our learning has evolved. And so I'll share some of how we've learned our way into this population health kind of view of the problem and how to apply public health strategies. It all begins with, in fact, where you're beginning now, with starting a housing company. I started an affordable housing company. I was just noting it was 30 years ago today we got our first big supporter on board, and started in New York City. And over the course of 20 years, built over 3,000 units of housing in the New York City area. You're seeing some of the buildings and very successful programs. People who moved in never became homeless again. We thought of these buildings as small communities. We had social workers and health workers on site to see that people had support for the issues that had led to their homelessness, and buildings that contributed to their neighborhood. Really very well managed, beautifully designed buildings. But all around us, and Jared, if you could advance the slide, all around us, despite all of these wonderful programs we were operating and the new housing we were putting online, we continued to walk by really the same people who had been on the street for years. And so this disconnect finally became really a matter of conscience. Like, how can we really feel like we're operating, that we have a solution and that we've got our arms around this problem if we are still missing some of the most vulnerable people in our own neighborhood? And it was the provocation of some of the individuals, and Mick so movingly described the role of caseworkers who went out of their way to get to know what was going on, that people were getting stuck in this situation. And frankly, it was only people living on the streets in the Times Square neighborhood telling me about their situation and the bureaucracy that was causing them to be trapped that led us to really rethink, how do we work this problem differently? And so, Jared, if you could advance the slide. Mick and Dermot just discussed the importance of lived experience and of co-production. Well, they could have been describing this slide that I'm showing you, because what we started doing when we turned our attention from running good programs to really trying to understand, why do we have homelessness at this scale in New York anyway, even though we're building more housing and offering all of these services? And what we did, we started getting together groups of individuals from different organizations, from government, and people who are experiencing homelessness, and saying, all right, what does it take for a single individual to get out of homelessness in this city? Like, we have all these programs, we have all these services, and we had them actually, like, at tables, try to figure out, well, there's this requirement, that requirement, then you need to do this, and then you have to be eligible for that. Well, it was pretty overwhelming, and those individuals who were experiencing homelessness actually kind of told the folks who were working in the agencies the truth of the situation, which is our policies and the way our agencies worked were so disconnected and so over bureaucratized, it's almost impossible to get from the street to a home. And this was the beginning of a new way of working for us that was really about, how do we get to that end state goal of getting people into housing as opposed to running programs. And the only way we could actually see the flaws in the system and how many rules and assumptions needed to change was the powerful insights of those who are experiencing homelessness. This kind of analysis tool, this mapping tool, that in this process for involving people in having the experience of homelessness, in telling the rest of us doing the work of building housing and running programs what was actually going on and how we needed to work differently, was the breakthrough event. And we've, I think, used this tool with over 200 communities in the United States now. But if we could go on to the next slide, please. The first thing we did when we realized just that, we'd seen the problem, it was us, the way we were working together, agencies and government, we focused on just a 20-block area of Times Square and getting to know by name every single person who was on the street for any period of time, and realized that people, first of all, needed very different things to escape homelessness. But we committed ourselves to the task, and we were learning from the Rough Sleepers Initiative in the UK, actually, of reducing homelessness by 2/3 in 3 years. And in the course of doing that, and we were successful at that, we developed new ways of getting people to collaborate, using data on who is actually experiencing homelessness to actually bend the course of the river. We then took those insights around how to help communities work differently together, and started responding to cities in the United States who are asking us for help. They're saying, we hear you're doing something in Times Square that's actually working. It's reducing street homelessness. And so if you could go on, Jared, to the next slide. That was the beginning of what's now the organization I lead, Community Solutions, which is taking a very different approach. While housing is so essential to ending homelessness, it's essential in the way a vaccine is to ending COVID. But we also know We've got to organize how to get the vaccine to people. We have to organize a process for developing and testing the vaccine. We have to do a lot of things in the meantime to make sure that we protect each other from the transmission of COVID. And so what we found is you need to couple the two, the housing and the operating system. And now we work across the United States, and happily, it's one of the things that, like you all in Ireland must think we're insane, like we can't get along or agree on anything. Well, there's a whole lot of agreement that we've got to work differently on homelessness. And you see communities of every political stripe working in this method I just described, which is to take a collaborative, data-based public health approach and just work the problem and get this problem to zero. And so if we could go to the next slide, Jer. We didn't make the leap from Times Square to in our 20 blocks and figuring it out there to working across the nation in one step. What we did for a 4-year period from 2010 to 2014 is we just opened up the opportunity to any community to learn to work differently, to use this beginning of this methodology of how do we actually help get people into housing and just bypass programs and the situations that are causing them to remain on the street or stuck in bedsit accommodations. And we called that effort the 100,000 Homes Campaign. And the goal was collectively across the nation, could we accelerate housing placements? Could we actually just take a lot of those crazy steps out of that kind of almost board game looking like slide that I showed you, a chutes and ladders, tragic consequences game. So we took those learnings and helped 186 communities signed on, helped them actually take a lot of the steps and confusion out of the process and get everybody rowing in the same direction to get more people housed. And it was wonderfully effective for what it did in that 4-year period. More than 105,000 chronically homeless and medically frail homeless individuals moved into permanent housing, which was just tremendous work that those communities did. But if we could move to the next slide, one of the things that didn't happen was no community ended homelessness. So we took a pause, and at the beginning of 2015, started something that's called Built for Zero, and it's the work that is so powerfully hopeful now in driving reductions in homelessness and lasting ends to homelessness in many communities. And so the challenge of counting down to zero is really different, and it's harder than counting up to a big number, doing more of a good thing. Always good, more housing, more effort of getting people housed. But we found that to get to less of a bad thing, fewer people experiencing homelessness, means that communities had to work together in a very different way. It had to really be about leaving almost your program hat at the door and forming a team across organizations, across government, and very importantly, learning by name in real time who is experiencing homelessness and what it would take for each person to get the help they needed, the most effective help in the quickest amount of time. And so if you could move to the next slide, Jer. What this process looks like, interestingly, and you're wondering probably, what's this slide? What this process looks like and what has informed the Built for Zero initiative is the work of victories in the global health field. You're looking at an image of the team in Nigeria that's working on ending polio in that country. And it's down to polio has been eradicated in most countries. It's been a stubborn challenge in Nigeria. But in Nigeria, all of these health organizations, local, international, they are working this problem down to zero in the way we're working the problem of homelessness down to zero in the United States. And all of us, whether you're working on polio or malaria or multi-drug resistant TB or traffic safety and the Vision Zero movement, or there's a program called Cure Violence that is around violence interruption in the United States. We all have as our root the major insights from the world of global health in the fight against smallpox, because the vaccine existed for like 200 years, and yet smallpox hadn't been eradicated and was killing tens of millions of people. And it wasn't until scientists, doctors, public health officials local people all over the world who were frontline health workers figured out how to build a delivery system that wasn't just about getting people vaccinated, but which people needed to be vaccinated and who had been exposed, and how do you actually contain a problem and use a whole team approach and data and a learning strategy to solve that problem. And so that's what gives us a lot of confidence that what we're seeing in terms of the progress on homelessness in the United States is so exciting and to be trusted and shareable, because it's rooted in things that work and that have a science base and they're collaborative, and that we have so much experience as humans in realizing work because they have worked elsewhere. And so, Jared, if we could advance the tape. And so this involves, as I'm saying, like we all need to do our key work. We all need to do our key work as in our programs, but they need to be part of community-wide systems. And that is a new thing, perhaps, to get your head around in homeless services. But certainly the doctors on the call, the public health officials that are part of the meeting, they understand the two levels of thinking, that you need to actually, from a public health and a population health standpoint, be looking across a whole population, not just what's happening in your program. And I've gone so far to say with my own team, like, we don't get to declare victory that we're running good programs if homelessness is not going down in the communities that we work in. So we really have to hold ourselves to two standards. Good program, but are we driving that problem down? And next slide, please. What we have found are the key things that the communities that are getting to zero, and there are now 48 communities, so more than half of our communities are steadily reducing homelessness, and 13 have already ended chronic or veteran homelessness and are well on their way to ending homelessness among all singles, and population by population, just driving this down. But what the communities that are winning have in common, they start with a shared measurable aim, which is about solving for the whole. The whole community is going to have zero homelessness, not just my program is going to be a good program. They have put a team together that bridges government and the key not-for-profits in the communities and the what we call in the United States housing authorities, or the social housing associations, as you now have your own. Those communities have a flexible arsenal of resources, not rigid, kind of program funds only. But sometimes what gets a person out of homelessness is a very light touch solution. And sometimes, the needs change very quickly. And so flexible funds that one, but to study what's working among the different interventions across the community and also for individuals. And then we start with a testable deck of strategies. Would be housing, and housing without a ton of restrictions. And so, we've been hearing on the program about low threshold and housing first. Those represent very flexible resources that can be critical to getting this job done. So next slide, please. This is what this is okay. This is what the data looks like, and then next slide. Here are our results to date. Here's what it looks like in a community that is using data. Ways so that it is focused on this coordinated system, and that we're using local social impact capital to buy housing that's just otherwise market rate housing and plug it into community needs that require it. Next. And Next, please. And so back to the beginning, we were housing people, and housing is essential. But next, it was insufficient. And I'll just end with this slide that I took in Paris on that. I took on Paris on my Vincentian Values course. You see there in the distance is St. Vincent de Paul, a beautiful mural on what was the site of Saint-Lazare, the massive place that was the center of his work of organizing charity and making coherent, effective charity a new thing for the world. But it's all that remains of the physical environment that was once this massive program. And when I was on the values course, not only was I inspired by the Vincentian tradition, but I was inspired by this reality that it's not about the buildings. The buildings are necessary for their time, but it's about creating a system of charitable work that works. So I'll end there, and thank you so much for inviting me to be with you.
Thanks so much, Rosanna. That was so interesting. I guess I'm going to start with you, if that's okay. And my first question to you is, in your experience, how difficult is it to get communities to a zero homeless solution?
Mm-hmm. Well, it requires a team. And so what the key thing is the political will on the part of at least two entities, like leaders in the not-for-profit space and usually someone in government, to say, the way we've been going about this is not working. And we've got to be open to trying something new and working with each other in new ways. It's interesting. I think anyone in the field knows that homelessness crosses so many issues, from health and mental health to housing issues to employment to family violence. And unless we start thinking of how to connect the dots, we tend to stay in our specialist zones. And the people who get hurt by that are the people who have the biggest challenges navigating across all of these different agencies and organizations and rules. And so if at a community you have leaders willing to say, we need to redesign the game, that we start with a very different shared aim, which is all this has to add up to fewer people experiencing homelessness. That's the most important part of change. It's that decision, that willingness to work differently and to rethink the problem.
Okay, and thanks so much for that, Rosanna. I think it's very much leading me on to what I'd like to ask you, David, and that is, what commitments are required for Ireland and Northern Ireland if we are to address homelessness in both jurisdictions, and particularly considering that idea of zero homelessness that Rosanna's been talking about today?
I suppose the commitment towards zero homelessness starts, doesn't it, with us thinking in terms of what it means for us as a service provider. And for me, that theme around the minimal use of emergency accommodation is kind of critical, that people only go into emergency accommodation if absolutely necessary, and they stay in emergency accommodation for the least period possible. I think we worked in a pilot in Belfast 3 years ago with the housing executive on a street to home initiative, and it's actually quite possible to work with individuals who are rough sleeping, and I know that's been and get them straight into homes rather than going through the staircase approach to solving the homelessness issue. So our philosophy and our approach is hugely important. I think the systems do exist and the partnerships do exist for ourselves. I think everybody knows that housing supply is key.
Okay.
The ESRI report last week poses the challenges that we have around affordability, around a fluid and volatile rental market, the impact that it will have on the ability of people to exercise credit and finance. So we're in for a couple of years of uncertainty around the wider housing market, but what can't change is our commitment to social housing funding, and as I said earlier on, the commitment to single people within that structures.
Yeah, and very much that commitment to the housing-led approach, if you will.
Housing-led with the wraparound supports and Roseanne's emphasis on what works for individuals in what cases, and a variety of solutions that are at community level are hugely important. And I think that we can definitely do more work in that area.
Thanks for that, David. Roseanne, I want to come back to yourself and just ask you, and particularly that last stage, if you will, how important is the health element in ending homelessness, and how has Community Solutions met this need?
Mm-hmm. Well, the health is element and integrating that is vital, and we're seeing that that's becoming really the next frontier in the United States. Some of our major partners now are healthcare systems, and they realize, because they see individuals in their emergency rooms and coming in for care, that is really as the result of just such unhealthy lifestyles that people can't escape on their own. And so integrating our approaches to housing and health is really where I think we're going to find the solutions. In addition to public health, that's the third leg of the stool. That is not just about individuals, but the health of the community, and having that whole systems view.
Thanks so much for that, Roseanne. David, last question to you. What additional health interventions and services are required to support those experiencing homelessness in the Republic of Ireland and Northern Ireland?
You know, if we look at COVID, Dermot, the blueprint now exists of what works. It really, really does, you know. And I think the incredible work that's been done in the last couple of months, I think, you know, from a European perspective and UK perspective, I think Ireland North and South has stood out in terms of bringing health to the forefront in the response. What we've learned in terms of the breaking down of bureaucracy and systems and access that's been demonstrated, there is absolutely no reason why that can't continue. And we know that there's a full commitment from our health colleagues within the statutory services to pursue that. I think what we need to say, though, very, very clearly is that, look, to government, please support health-related services in homelessness, and don't allow whatever financial challenges that we may have over the next couple of years take our eye off the ball of what's actually being gained. And we need an improvement in health funding. We don't need a cut, and that's as important, Dermot, for our workforce as it is for our service users, because our workforce have gone beyond what any employer could ask of them with regards to response, and that absolutely needs to be reflected in government's approach to how terms and conditions for those workers within the voluntary sector, the wider voluntary sector, but also within homelessness, on how we support a progressive wage structure going forward in order to acknowledge the professionalism and skill, not only that they've shown with COVID, but also throughout the normal delivery of service provision that we've had since our beginning.
Yeah. And I think one of the things, just to touch on Northern Ireland, and particularly I'm thinking of, we've talked a lot today about partnership and collaboration and the need to bring health to support. And I'm thinking of Housing First, and you touched on earlier the idea that we need to bring the Public Health Agency into the fore to support Housing First.
We've got a government and ministerial commitment to Housing First in Northern Ireland. In the Republic and in other places, what's shown to work is health have to be an equal partner. And that's what we're calling for now. We want health to be an equal partner in the delivery and funding of Housing First services in Northern Ireland, and I think we can get to that place.
Okay, and thanks so much, David. So we're nearly there. We're coming very close to the end. And to finish off the event today, we'd like to share a video with you. Just before we do that, I want to say thanks to Roseanne for joining us today. I think it's been hugely illuminating, and I personally got to look at your presentation earlier and loved it. I'm sure we'll get a copy and ensure that it's available with the presentations later. So thanks so much for joining us today, Roseanne.
My pleasure. Congratulations.
Thank you, Roseanne.
Thank you. So as I said, we're going to move on to doing a short video that we want to share with you guys from one of our service users who kindly recorded it for this event. Dorian is a resident at Clover Hill, different accommodation completely, in Dungannon, County Tyrone. Dorian is a passionate storyteller and a writer, and was happy to get the opportunity to read a video for us today. I think we've had the opportunity to have Dorian present at our 10-year anniversary before for us, so I hope you get to enjoy his presentation as much as we have.
Hello, my name is Dorian Sutton. I am a resident at Castle Hill, Depaul. I would like to thank Depaul for giving me this opportunity to showcase my creativity, which I'm going to do here now by reading a poem to you. The hallowed Machin's barn. The dark willow trees spread chaotically around, the corpses and skeletons buried deep below the ground. Headstones and monuments lay old and worn, our destination from the moment we are born. The gate into the old cemetery growls with a loud creak, echoing into the autumn sky that is met with a crow's shriek. The arches in stone, both haunting and foreboding, the architecture of churches and cathedrals never eroding. The atmosphere of these enhanced by the autumn night, it is nothing but a pleasure when met with my sight. The moon gibbous in silver up high in the sky, the stately and wise old raven that passes me flying by. An owl sits perched up on the dead tree, watching silently as Lenore begins to flee. Softly does the autumn breeze blow, causing the flowers to sway. The dead leaves dance fantastically on this night, when spirits come out to play. The trees twist, casting shadows of death. When witnessed, it would halt her breath. Spiraling down the old staircase, down to the old mansion's base. Looking out the window, a pale grim face, like the one in the painting, above the proud display case. Belonging to the baron who once carved out an empire, residing in the mansion now as a brooding vampire.
And here we are back in the studio again. I think that was a wonderful video for us to have watched, and again thanks to Dorian for doing that for us. Before we conclude today's event, I'm just going to pass you over to David for last few words. David.
Thanks, Dermot. This has been an experience for us. It's the first time that we've done something of this nature, and I want to absolutely thank the support team within Depaul and the technical team here today for all of the work that has been done to get this event up and running and delivered in this way. It's been hugely impressive, and I've hugely proud to be at the forefront with yourself and demonstrating the work that we did in 2019, but also illuminating to people that, you know, we are committed to ending homelessness on this island. I want to thank our statutory funders, both north and south of the border, for the support and the partnership working that we have with you, and our donors as well, and all of our grant makers and our corporate partners who we know are watching today. We know we actually have people from the wider Vincentian Partnership and Depaul International watching today. So we have a truly wide-ranging audience. Thanks to our staff who are watching today as well, and I hope that you think that our work is being reflected and your work is being reflected properly, and the excellence of that. But most importantly, thanks to the people with lived experience who took part in the piece today, but all of our service users who work with us on a day-to-day basis in order to overcome the challenges to end homelessness. So thank you so much.
Thanks so much, David. And that concludes the launch of Depaul's annual report for 2019. Again, my thanks to our wonderful guest speakers and to everybody who joined us to help launch our report. If you didn't make it to the full event, a recording will be available on our website, which is depaulcharity.org. And if you'd like to know more about the work of Depaul or to get involved, you can also visit depaulcharity.org to find out more. Thank you for joining us, and have a great afternoon.